The member for Miramichi in the gallery.
Thank you, Mr. Speaker. Mr. Speaker, rotational workers are pleading to be heard. The hardships caused by these new regulations have been unbearable for them and their families. Most work at isolated locations with little or no cases and then come home to stay alone in their homes or pay weeks for accommodations in hotels. This is not isolation. It's akin to solitary confinement. Other Atlantic provinces also have rotational workers, and they allow them to go for a drive, go to their camp, or at least take a walk around their yard, and are able to get tested to be with their family. No harsh restrictions, nor do they have the cases indicating they are at risk. New Brunswick is the only province confining our workers. They have been asking for weeks for public health to provide the data to support these harsh regulations. Mr. Speaker, we encourage everyone to follow public health guidelines, and everyone wants to keep people in New Brunswick safe. But in a time when we should be coming together, we're being split apart and pitted against each other. We are told this pandemic can continue for months, if not years. We're asking that some relief come to these workers, that the data and the rapid testing may be available to them so that they can have just a little time with their family and their kids and their spouses. Thank you, Mr. Speaker. Mr. Speaker, the rotational workers are dealing with some very serious issues. They're crying for help, and they need some answers. Being confined for months is not healthy. Not only does it affect their mental health, but some have health conditions like diabetes that need regular appointments and blood work. Their spouses are having to choose between isolating with them or moving out and keeping their jobs. And the kids are told to stay home from school with no accommodations made online learning. We're told stories of kids getting bullied at school, teenagers living with their families, living without their families so they can attend school, and they're having to do their groceries and errands for the families. These workers are being treated differently than the essential workers who travel across the borders daily and are able to get tested regularly with no isolation required. Mr. Speaker, these approximately 3,700 workers are essential, and they sacrifice to provide for their family while bringing money into our province, and many of them are considering leaving the province. Mr. Speaker, can the public health please provide the actual numbers of cases that were brought in by rotational workers in New Brunswick, and can the rapid testing be used on rotational workers so that they can have fewer days with their spouse?
The Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, I believe the misconception is that this policy targets one group of people, and it does not. This is a policy directed to travelers who leave this province and go to other provinces that are hotspots, travelers who go through 1, 2, 3 different airports before they come home. Mr. Speaker, there is nothing more concerning to this province right now, and every member of the COVID Cabinet Committee, every member of this legislature should understand the reality of what will happen if a variant gets into our communities without being caught. And we know from our temporary foreign worker experiments that when we brought them into the province and we made them isolate for 14 days, they did not transmit to anyone. Thank you, Mr. Speaker.
The member for Miramichi in the gallery.
Thank you for the answer, but they're not travelers. They're working essential workers, and all the other essential workers are able to get tested, or even the Irvings, the company that have been able to get rapid testing, or under a pilot project or something. They're getting angry, they're depressed, they're frustrated. Their mental and physical health is taking a toll with no end in sight. How long are these expected to, are they expected to live under these conditions? And can something be done to find a middle ground so they're tested and treated like all the other essential workers?
The Minister of Health.
Mr. Speaker, today we have in excess of 160 or 70 cases that are active. And our daily numbers are coming down, and that's a really good thing. In December, before the holidays, we had 44 active cases. And then in January, Mr. Speaker, we had 567, more than all of 2020 together. Now we have a variant, and the variant is more transmissible. It will spread faster. We will not be able to contact trace, and it will explode if we are not extremely diligent. I know this is a very, very difficult time. I understand that. These measures have been in place for a few weeks. And Mr. Speaker, we want to get back to normalcy as soon as possible. And if we stay diligent, we can get back to yellow. We can get back to the Atlantic bubble.
Thank you.
Thank you.
Time is-